Have you ever stopped to look closely at the toilet bowl before flushing, or do you do it automatically? Perhaps this morning you noticed something different, a thick white foam, similar to beer foam or meringue, that stubbornly refused to disappear even minutes after you urinated. Most people over 60 look at this and think it's just the force of the stream, or something they ate the day before, completely ignoring that this could be the most important cry for help your body will emit in this decade. There's a dangerous and silent belief that kidney problems are always accompanied by sharp back pain, that unbearable twinge in the lumbar region. But the harsh medical truth is that the kidneys are stoic and silent organs. They can lose up to 90% of their function without triggering a single sign of physical pain, slowly dying while you go about your routine thinking everything is fine. The great tragedy of chronic kidney disease, CKD, is not the disease itself, but the fact that it warns us through visual codes that we are rarely taught to decipher in time. What I'm going to share with you today is not just an informative video, it's survival training for your vital organs, based on a daily self-examination that anyone can do in the comfort of their home. A recent study revealed something surprising and frightening. Millions of people are heading towards hemodialysis unknowingly, simply because they ignore subtle changes in urine texture and seemingly mundane bodily sensations. Today, I'm going to give you the 5 red alert signs, the real warnings that your kidneys are giving up, so you can act, preserve your kidney function, and ensure that your independence in old age isn't stolen by a dialysis machine. Before we delve into these 5 vital signs, I need to ask you a very simple and quick question, and I want you to be honest with me in the comments below. Lately, have you noticed any changes in the color or amount of foam in your urine? Or do you feel like you need to get up many times at night? Answer with a yes or no. And if you want, describe what you've noticed. This exchange of information is crucial because often we think we're the only ones going through this, but by reading the comments, you'll see that you're not alone. Chronic kidney disease is a hidden epidemic among us, especially for those over 50. And the first step in fighting this invisible enemy is admitting that we need to look at our bodies with more attention and less negligence, transforming daily observation into our most powerful diagnostic tool. To understand the seriousness and logic of the signs I'm about to list, we need to visualize what's happening inside you right now. Imagine your kidneys not as 2 static organs, but as 2 highly precise coffee filters composed of millions of microscopic units called nephrons and glomeruli. The primary function of these filters is to act as an intelligent sieve. They must retain what is precious to the body, such as proteins and blood cells, and allow only toxic waste and excess water to pass through. When this sieve is intact and healthy, the coffee, which would be your urine, comes out clear, without solid residue. But aging, combined with years of high blood pressure or elevated blood sugar levels, begins to create small holes in this sieve. The physiology is clear. A scarred or damaged glomerulus does not regenerate. Once lost, a part of its filtering capacity is gone forever. Here's the shocking fact that nephrology societies around the world are desperately trying to communicate. Hypertension and diabetes are the biggest nephron killers out there. If you live with high blood pressure or uncontrolled glucose, your kidneys are under constant attack, suffering internal hydraulic pressure that forces this delicate sieve until it tears. When this happens, substances that should remain in your blood, such as albumin, an essential protein, begin to leak into the urine. It is this leakage, called proteinuria, that generates surface tension in the toilet water, creating the foam I mentioned. The problem is that initially this process is painless. You don't feel the hole opening, you don't feel the nephron dying. You only see the visual result, and that's why your attention to detail is the only barrier between health and kidney failure. Now that you understand the mechanism of the leaky filter, we're going to structure your knowledge into a practical and progressive list. I've selected the 5 most critical signs, starting with the most visible and moving on to those that affect your body systemically and dangerously. Number 1 is the most classic, but number 5 is a sign of advanced toxicity that requires immediate action. I want you to see this list as a checklist for maintaining your own life. It's not about generating panic, but about giving you the control that ignorance takes away. If you identify one or more of these symptoms, don't despair, but prepare to act. Let's start with the sign that is literally right before your eyes every morning, and which, unfortunately, is the most ignored of all. The first sign, and perhaps the most revealing of all, is what we call persistent foamy urine, or in medical terms, proteinuria. I'm not talking about those quick bubbles that form due to the speed of the stream and disappear in seconds, like when you forcefully open a tap. I'm talking about a dense, thick foam, very similar to the foam of washing powder in a washing machine or the head of a well-poured beer. This foam remains in the toilet bowl for minutes, and often you need to flush twice for it to go away completely. If you observe this phenomenon frequently, it's not just a physical curiosity, it's your body screaming that the protective barrier of your kidneys has been breached. It's the clearest visual sign that the filter isn't just dirty, it's leaking vital components. To understand why this happens, go back to the analogy of the sieve, or a coffee filter. In a healthy kidney, the glomeruli are smart enough to trap large molecules, such as albumin, which is the main protein in our blood and essential for keeping water within blood vessels. When hypertension or diabetes damages these microfilters, the holes in the sieve increase in size. The result is that albumin escapes, falls into the urine, and due to its chemical properties, alters the surface tension of the water, generating this characteristic foam. Realize the seriousness of this. You are literally throwing your nutrition and muscle strength down the vessel. The practical instruction here is simple. Observe. If the foam is constant, this requires immediate investigation with a urinalysis and creatinine level measurement. But protein loss doesn't come alone. It brings with it physical consequences that lead us directly to the second warning sign, peripheral edema, or that swelling that simply won't go away. Have you ever noticed that upon waking your eyes seem swollen with heavy bags under your eyelids as if you hadn't slept well, even after a night's sleep? Or at the end of the day, your shoes seem to have shrunk and your ankles disappear, turning your leg into a straight swollen spine? Unlike swelling caused by heat or a long trip, renal edema is persistent and signals a catastrophic failure in your body's fluid regulation. The mechanism behind this swelling is purely hydraulic and chemical. When the kidneys lose their ability to filter, they stop eliminating excess sodium, salt, from your body. Sodium acts like a sponge, desperately retaining water. Furthermore, remember the protein you lost in your urine in the previous section? Without enough albumin in the blood to hold the water inside the veins, this fluid leaks into the surrounding tissues, accumulating where gravity dictates, in the feet and legs, or where the skin is thinner, such as around the eyes. It's not fat, it's retained and dirty fluid that your kidneys couldn't expel. The sensation is one of heaviness, tired legs, as if you were carrying bags of sand tied to your shins. To find out if your swelling is worrisome, do a practical test right now or the next time you notice edema. Firmly press the swollen area of your shin or ankle with your thumb for about 5 to 10 seconds and release. If the skin immediately returns to normal, that's a good sign. But if a deep indentation remains, a mark from your finger that takes a long time to disappear, what doctors call pitting edema, this indicates significant fluid retention. This is your waterlogged tissue, screaming that your body's drainage system is clogged. This is a symptom that directly affects your mobility and quality of life, preventing simple walks and the use of comfortable shoes. Before we move on to the third sign, which is often confused with prostate or bladder problems, I want to take a quick break to ask you for something that greatly helps our channel grow and spread this vital message to more people. If you are learning something new and useful from this video, please click the like button and make sure you are subscribed. It's a small gesture for you, but for us, it means that YouTube will show this alert to another senior citizen who may be ignoring foam in their urine right now, unaware of the risk. Let's create a chain of prevention and health together. Thank you for being part of this self-care community. Now, let's move on to the third sign, which is a drastic change in urinary frequency, technically known as nocturia. It's very common, especially among men, to blame the prostate for everything, or among women to blame a dropped bladder. But when it comes to kidney failure, the problem runs deeper. The sign here is the need to get up 3, 4, 5 times a night to urinate, interrupting your restorative sleep cycle. And pay attention to the quality of this urine. Often it's clear as water, transparent, which can give you the false impression that you are well hydrated, when in fact, it may be the opposite. What's happening is that the kidney has lost its ability to concentrate. A young, healthy kidney can concentrate toxins in a smaller volume of water overnight, allowing you to sleep 6 to 8 hours straight without needing to go to the bathroom. A diseased kidney loses this intelligence. It can no longer squeeze the toxins, so it needs to use much more water to try to eliminate the same amount of dirt from the blood. It works at excessive volume, but with low cleaning efficiency. You urinate a lot, but it doesn't clean the blood as it should. It's a desperate effort by the organ to compensate for its own functional failure. The impact of this on your life is devastating in the long term. Sleep fragmentation prevents you from reaching the deep stages of rest, generating chronic fatigue that is not resolved by naps during the day. You wake up tired, irritable, and with a foggy mind. Furthermore, there is the other, extreme, equally dangerous, oliguria, which is when urine production drops drastically. If you notice that you are drinking water but not going to the bathroom, this is a medical emergency. But in the initial chronic phase, excessive nighttime trips to the bathroom with pale and odorless urine is the most insidious pattern. And this fatigue that comes from sleepless nights connects perfectly and frighteningly with our fourth sign. Because if you think you're tired just because you woke up, or many times during the night, you need to understand what the kidneys do to your blood besides filtering it. There's a hormonal function of the kidneys that almost no one talks about, but it's responsible for keeping you rosy-cheeked, warm, and energized. When this function fails, tiredness turns into profound exhaustion, and this leads to a symptom that many elderly people experience but attribute only to old age, without knowing that it can be corrected. This brings us to the fourth warning sign, which is extreme fatigue accompanied by a constant feeling of cold, a classic symptom of renal anemia. Have you ever felt a fatigue that seems to be in your bones, a weakness that doesn't improve even after a full night's sleep or a relaxing weekend? Along with this, pay attention if you feel cold even on warm days, needing to wear coats or socks when everyone around you is comfortable in a t-shirt. It's very common for family members or even the elderly person themselves to classify this as things of old age or laziness. But physiologically, this is your body trying to function with very poor quality fuel, indicating that your kidneys have stopped performing a vital function that few people know about, hormone production. The science behind this is fascinating and crucial to understanding. Your kidneys don't just filter urine. They are powerful endocrine glands that produce a hormone called erythropoietin, or EPO. EPO is the telegram the kidney sends to your bone marrow with the order, produce more red blood cells now. Red blood cells are the trucks that carry oxygen to every cell in your brain and muscles. When the kidney becomes diseased and loses function, EPO production plummets. Without this order, the bone marrow stops making new blood. The result is severe anemia that isn't solved simply by eating iron or beans, because the problem isn't a lack of iron, it's a lack of production order. You become pale, breathless, and perpetually exhausted because your cells are literally suffocating from lack of oxygen. Understanding renal anemia completely changes how you approach your daily life. If you feel like you're dragging your body to do simple tasks like gardening or going to the bakery, that's not normal aging. It's a clinical sign. And the danger increases because the heart, trying to compensate for this weak and oxygen-poor blood, begins to beat faster and harder, which can lead to secondary heart failure. The practical instruction here is clear. When you have your annual checkup, don't just look at your cholesterol. Check your blood count. If there is anemia, ask your doctor if it could be of renal origin. But if anemia is already causing an impact, the next and final sign on our list indicates that the internal situation has reached a critical level of toxicity. We've reached the fifth and most dangerous sign, a metallic taste in the mouth, and ammonia breath. This is the final fire alarm before a systemic collapse. Imagine sitting down to eat your favorite food and suddenly tasting iron as if you'd bitten into a coin or a piece of aluminum, or noticing that your breath or the smell of your own perspiration resembles the strong odor of urine or ammonia. Often, this is accompanied by a sudden aversion to protein, especially red meat. Just looking at a steak makes you nauseous. This symptom is not a stomach or dental problem. It's proof that the filtration system has almost completely stopped and your body is becoming a biological waste dump. The biological mechanism here is called uremia, which literally means urine in the blood. Because the kidneys are unable to filter urea and other nitrogenous toxins resulting from protein digestion, these poisons accumulate in the bloodstream. When the concentration becomes very high, the body desperately tries to expel these toxins through other means, one of which is through the lungs and saliva. You begin to exhale toxins that should have been flushed down. The toilet. The immediate consequence is malnutrition, as the bad taste prevents eating, leading to rapid and unintentional weight loss that further weakens the elderly person, accelerating physical frailty. If you or someone you love experiences this persistent metallic taste, the instruction is not to observe, but to seek immediate medical attention. This requires immediate medical evaluation, as it indicates that kidney function may be dangerously low, perhaps below 15% or 10%. Unlike foamy urine, which is an early warning sign, uremia is a sign of advanced stages. However, even in these cases, correct diagnosis can allow for life-saving interventions and, in some scenarios, adequately prepare the patient for replacement therapies, avoiding traumatic emergencies. And this leads us to the golden question: how to know the truth before experiencing a metallic taste in your mouth. How to be absolutely certain of the state of your kidneys. To connect everything we've learned and give you complete control, I need to introduce you to the two most powerful tools in nephrology, which are the golden recommendation of this video. Many people spend fortunes on detox supplements, but ignore two inexpensive, accessible, and definitive blood and urine tests. If you've identified any of the 5 previous symptoms, foaming at the mouth, swelling, nocturia, fatigue, or a bad taste, you don't need to panic, you need data. The only way to see what's happening inside your body's black box is through 2 simple tests: creatinine and urinalysis. These are your true allies in the fight against dialysis. Creatinine is the #1 marker of kidney health. Think of it as the waste produced by your muscles that your kidneys must expel. If your kidneys are functioning well, creatinine in the blood is low and in the urine is high. If creatinine rises in a blood test, it means the filter is clogged and waste is accumulating inside you. It's a mathematical test. With the creatinine value, the doctor calculates your glomerular filtration rate, which tells you exactly what percentage of your kidney function is still working. It's like looking at your cell phone's battery meter. You'll know exactly if you have 90%, 60%, or 20% of kidney function remaining. Without this number, you're flying blind. The urinalysis, or EAS, is the detective of early clues. It will confirm whether that foam you saw in the toilet bowl is actually protein, albumin, or not. Sometimes creatinine is still normal, but the urine test already shows protein loss or the presence of microscopic blood. This allows the disease to be detected in stage 1 or 2, where reversal or control is much easier. The combination of these 2 tests offers a complete picture. One tells you how well the kidney is functioning, creatinine, and the other tells you how it is structurally, urinalysis. There is no real prevention without having these 2 documents in your hand once a year. My practical recommendation for you today is: don't wait to feel pain, because it won't come. At your next appointment, whether with a cardiologist, geriatrician, or general practitioner, don't just ask for a checkup. Be specific. Say, "Doctor, I'd like to check the health of my kidneys. Could you order a creatinine level test and a urinalysis?" This proactive approach shows that you value your biological machine. Remember, doctors see hundreds of patients, and sometimes the focus is only on blood, pressure, or sugar, and the kidneys go unnoticed until it's too late. Take charge of your health. Throughout this video, we navigate from the visual sign of foam in the toilet bowl to the systemic sensations of uremia poisoning. The takeaway I want you to take to bed tonight is that your kidneys are silent organs, but extremely communicative if you know their language. They work tirelessly, filtering about 180 liters of blood a day, never asking for a vacation. Chronic kidney disease is frightening, yes, but it loses its power when illuminated by knowledge and early detection. The fear of dialysis shouldn't paralyze you, it should fuel preventive action. The great news is that if detected in its early stages, thanks to observing foam or swelling, kidney disease has conservative treatment. With adjustments to diet controlling salt and protein, proper hydration, and rigorous control of blood pressure and diabetes, it is perfectly possible to stabilize kidney function and live for decades with quality of life without ever needing a machine. You have the power to preserve the nephrons you still have left. Physiology is resilient, and your body fights for life every day. It just needs you to be on the same team as it, not against it. Now, I have one final mission for you, and it's very important. If you have friends or family who suffer from diabetes or high blood pressure, the two biggest enemies of the kidneys, share this video with them right now. You could be saving that person from a future of hospital dependency just by sending a link. And tell me in the comments, which of these 5 signs will you start monitoring from today? Will you check the foam? Will you squeeze the ankle? Your participation inspires others to take care of themselves. Always remember, listening to your body is not hypochondria. It's the first and most important step to healing it and ensuring your freedom. A final health and responsibility warning: all content presented in this video is strictly educational and informative, based on physiology and public health guidelines, but does not, under any circumstances, replace professional medical advice, diagnosis, or treatment. I am a screenwriter and health researcher translating science for you, not your attending physician. Every organism is unique and reacts differently. Therefore, never ignore professional medical advice or delay seeking treatment because of something you've seen here or anywhere else on the internet. If you have identified the symptoms mentioned, schedule an appointment. Self-medication or discontinuing medication on your own can be dangerous. Use this knowledge as a guide to inform your conversation with the doctor, not as a substitute for medicine. Take care of yourself responsibly. Your kidneys and your family will thank you.